different systems of medicine.
Go ahead, Dr. Uma. Sorry. I think she got cut off.
Yeah, I think she got disconnected.
As a filler, as she'll come back again. GCSMR, as I mentioned, is a purely volunteer nonprofit organizations. Everybody, so 100% of the funds we are collecting right now is going towards the establishment of this integrative center using Siddha and allopathic medicine at Manipal University. And as soon as Dr. Uma Sundar Kumar joins, she's, I think, just came back on. Uma, take it over. Thank you.
I'm sorry about the interruption. So yeah, we have two wonderful speakers today, physicians from two different systems of medicine, allopathy and Siddha. These doctors have graciously agreed to spare their time to educate us about COVID-19, its impact in children, questions and concerns about vaccination in children, and prevention and protection as kids are returning back to school. I'm sure as parents, we all have a lot of questions and concerns with regards to this. So today, each speaker will have 20 minutes to share their thoughts, and after which we will have question and answer session. I would request all our wonderful audience to keep your questions until both speakers have given their talk. So you can either unmute yourself to ask your questions, or you can send your questions in the chat box. So if you're all ready, we can jump into the topic. So our first speaker, it gives me a great pleasure to introduce you, our first speaker, Dr. Ram. He is a practicing pediatrician. He serves as a chairman of pediatrics at Ascension Providence Hospital, which is one of the major hospitals in Michigan. And also he serves as the clerkship director for Michigan State University College of Medicine. He graduated from Chengalpet Medical College in 1997, after which he trained both in United Kingdom, worked over there, and then shifted to US, trained in US. During his training in pediatrics, he received multiple accolades and awards, including Pediatric Academic Achievement Award, and his exam score was top 2 in the whole country. I had to mention this because these in-service exams are not so easy, especially when you are in the grueling residency training. You hardly get time to prepare for these exams, and he scored top 2 in the whole country. He is an excellent teacher and has received many teaching awards, including Educator of the Year Award. He is involved in research and has multiple publications in reputed journals. I'm confident that you are all excited as I am in listening to Dr. Ram. With that, over to you, Dr. Ram.
Dr. Ram, we can't hear you. You're on mute.
Oh, sorry. Yep. I unmuted myself. Thank you.
Okay.
I start all over again. Thank you, Dr. Uma and Dr. Sivaselam sir and GCSMR for this opportunity. Good morning and good evening to the audience wherever you are in the world. Dr. Uma approached me about a couple of months ago about this topic. Then I prepared the slides. Then I waited for the latest information from American Academy of Pediatrics and Center for Disease Control. So the coronavirus, it is not new to humans. We found out there's a human coronaviruses been existing for a very long time. We found it about a few decades ago. Then these coronaviruses are usually species specific. They usually affect humans, only humans. When they affect the animals, they affect the animals. Occasionally, they do make a jump from one animal to another animal. Like this one happened in 2002, then happened in 2012, then 2019. That is when the latest jump happened. So that virus is called SARS-CoV-2. The disease caused by virus is called COVID-19. I would use the word COVID for our presentation. So the COVID illness in children, I divide them into 4 categories. Asymptomatic, which means the no symptoms, then mild to moderate, severe, and death. We really don't know how many children are asymptomatically affected, meaning they have the virus, they don't have any symptoms at all. It does happen, but we really don't know what the statistics, how many children are affected like this. I'll explain to you in mild to moderate symptoms in a detailed manner in a different slide. If the children are affected severely, they're more likely going to be admitted in the hospital. Then we'll find out what the rates are. So American Academy of Pediatrics collecting the data from all the states for the past 19 months. As of October 14th, 6.2 million children were diagnosed with the COVID. Out of them, 0.1 to 2% were hospitalized. That means 98 to 99% of children were not hospitalized with this illness. So either they are asymptomatic illness or they are a mild to moderate illness. You can look at the death rate, very low. That's the good news. Recently in the social media, I came across a meme which mentioned about so many children are dying in US. If you multiply the 0.03 with the 6.2 million, roughly comes about 180 children. I mean, the denominator is very high, 6.2 million children are affected. Out of them, 0.03% they did die. Even a single death is not acceptable. But fortunately, it is not, the number is not very high. And the hospitalization rate is not very high either. So what are the mild to moderate symptoms? Fever, cough, runny nose, muscle or body pain, headache, sore throat, congestion, nausea, vomiting, diarrhea. You all know these are the common symptoms and signs of common cold or common viral infection. That is how the COVID presents in children. Most patients I have come across, they have either one or more of the symptoms. That's all they have. The loss of taste and loss of smell is very unique to COVID-19, but not everyone has that. So we cannot say you don't have a COVID just because you can smell things or you can taste things. At the same token, if you have a runny nose or a cold, you could have a COVID, you may not have a COVID. It could be a common cold. That is the most common reason, but it could be due to COVID. I get a lot of questions about fever. So we have to define what the fever is. Most pediatricians would agree, fever meaning any temperature above 100.4 degrees Fahrenheit or more than 38 degrees Celsius. So 99 is not a fever, 100.1 is not a fever. So whenever you feel like your children feel hot or warm, check their temperature. If it's under 100.4, it is not fever. So you don't have to give a medicine, fever reducing medicine to children. Is fever really bad? No. But prolonged fever, if a fever is persisting for more than 72 hours, remember, fever always comes, goes down, it comes back again. It is not going to stay high with or without medicine. It will always comes down, it will go back again. Like this, it goes for more than 72 hours. That is 3 days. Get a medical help. Definitely see a doctor. I used to say 5 days before. Since the COVID started, it becomes 7 and 3 days now. Fever and a rash, fever and a pink eye, fever and a lymph node swelling, which is a glands in your neck area in this area. Either rash, pink eye, lymph node, are they really bad? No, most commonly it is due to common viruses, or it could be a common bacteria, easily treatable, but it could be due to COVID. Then definitely get a medical help. So what are the COVID severe symptoms you need to worry about? Difficulty breathing from the chest. Everybody has a cold, they have a blocked nose, which is normal. I'm talking about difficulty breathing from the chest. The child has a difficulty breathing when keeping the mouth open, still cannot breathe well. That means there is something wrong with the lungs. You should get an immediate medical help. Severe chest pain, persistent chest pain. Children complain of chest pain on and off. It goes away within a minute or two. That's okay. Persistent chest pain, half an hour to 1 hour of chest pain, definitely get a medical help. And children, when they get sick, they're not going to be active. They do lie around more than usual. The child is sleeping throughout the day. Very difficult for you to wake up. The child doesn't want to get up, doesn't want to walk, does not want to move the arms or legs. Then there's a problem. The child is, what the child talks doesn't make sense, confused, seeing things which are not there. Then there's something wrong with the brain. Definitely get immediate medical help. Then the dehydration. Children don't eat well when they're sick. They will eat well within few days, but they should drink fluids. If they don't drink enough fluids, they could be dehydrated. That means that urination will go down less than 4 times in 24 hours. If urination less than 4 times in a day, then there's a problem. If they have severe abdominal pain, severe stomach pain, then it could be an issue, get a medical help. Neck stiffness, if they cannot turn the head this way or this way, any joint swelling, get a medical help. The children look blue color to you, the skin, lip, or nails look blue or gray. You should call 911 or ambulance immediately because they're very sick. Fortunately, these symptoms are not common in children with the COVID. You might have heard of this condition called the multisystem inflammatory syndrome in children, in that the children have fever for a few days, they have a lymph node swelling, they have pink eye, or one of their organs, 2 or more organs are affected, either a heart or a lung or an abdomen. Skin could be affected. They could have a different kind of a rash. This is a scary thing for parents. According to Center for Disease Control, they have counted 5,200 children in the last 19 months out of 6.2 million. Again, remember the denominator, 6.2 million children. The total death due to MIS-C is 46. So it is not a very common condition, but something we need to watch for because it could be treatable. This graph shows the MIS-C numbers along with the COVID-19 cases. You can see we had a one peak around the very first peak in 2020, March, April time. The MIS-C numbers started to go up. Then the second peak came around holiday time, Christmas, Thanksgiving time. Then the third peak is recently. We'll switch gear to virtual school because many parents are concerned, worried their children don't want their children to get sick. So they're keeping the children at home. They're sending them to a virtual school. I even recommended this to many of my patients last year. Now I'm moving away from that. Why? Now we have more than 1 year of experience the risk of COVID-19 illnesses, the serious complications are rare in children, number one. Then I'm seeing other problems. Children sit in front of a computer or a laptop or a phone for a very long time. Their body mass index goes up. Either they become obese or overweight. They end up with their eyeglasses. For a long time, we did not have a good proof watching the screen causes myopia, even though it's a common sense for us, but we didn't have good proof. The proof started to emerge about 10 years ago. Now the pandemic added another point towards this. Definitely longer screen time causes myopia or astigmatism. Then behavior problems. Now children, they go to school, they don't just learn things. They don't just learn the academics. They learn about social behavior. We are social animals. We are supposed to be with the other humans, age-appropriate group. When these are taken away from children, either they get depressed, anxious, they present in different ways. Children, they start to talk back, they shout, they scream, even simple things become a problem. It is their frustration. Not every child who is depressed, they're going to be showing the same symptom. They are present in a different way. Since these problems started emerge recently, it's better to send the children to school, in-person school when possible, and we have to teach them how to protect themselves. So how can you protect them? How can the children be protected? Mask for children, anybody who is older than 2 years of age. And we teach them how to wear the mask properly, covering the nose and mouth, not to touch the mask frequently, and a proper hand washing. Avoid touching the eyes, nose, and mouth. We all know about the social distancing, 6 feet or 2 meters. And what is social responsibility? So during this pandemic, almost all of us will end up with one of the symptoms. We'll end up with a cough, runny nose, sore throat, any of the symptoms we might get. At that time, we have to remember these symptoms could be a sign of COVID. Even though you don't have a fever, even though you don't have a difficulty breathing, even though you don't have all the symptoms of COVID. At that time, we have to isolate ourselves, isolate our children. When the children have these symptoms, please do not send these children to school. Do not send them to play with other children. Do not go to parties. Do not attend the function. Do not go to the temple. Do not go to anywhere else. Many times, parents, they themselves think, well, my child drank buttermilk. My child drank ice water. He played outside. She got exposed to the rain. That is why this happened. Please remember, this could be due to COVID. It is our responsibility to protect others. Imagine, God forbid, if your child had a COVID, then the child is fine, your child is fine, but got exposed to another child or whose parent who might be immunosuppressed. If they end up with a complication because of COVID, it'd be a major issue. So it is all our responsibility to contain this pandemic. So it depends on where you are. Vaccines are available for different age groups. In US, hopefully FDA will approve the vaccination. They reviewed the study from 5 years onwards. So these many children being vaccinated, you can look at those numbers. We know what the side effects are with these many million children, and we know it is very safe. So if your child is age appropriate, please get the vaccine as soon as possible. Then when should you test for a COVID? Yeah, I told you all the symptoms of a common cold illness. So when do we test for the COVID? And children do get sick frequently. It won't be just a one-time cold, correct? It can happen frequently. These are the common scenario you might want to test. Well, any symptoms of cold or a COVID, please isolate yourself. A fever lasting longer than 3 days, definitely get the testing done because it could be MISC. I showed you the MISC slide. It's very rare, but it could be treatable earlier stages. Severe symptoms I showed you. High-risk individuals at home, people who are immunosuppressed. And social reasons. Suppose your child has to go to a party in next few days. Our child is going to visit grandma and grandpa next week. You want to protect grandma and grandpa. Then child has a cold symptom now. Check, make sure it's not a COVID. Then if it's not a COVID, the symptoms are improving. If no fever for 24 hours, without a fever medicine, yes, child can go and visit grandma and grandpa. Please don't kiss grandma and grandpa. Do not share the spoon when you go there. So when you do a testing in our office, we roughly take care of 15,000 children. We have 12 providers. We have 15,000 children we take care of. We do between 300 to 400 tests per month. The positivity rate is 3 to 4%. That means 96 to 97% of COVID tests we do come back negative. These children have a common cold illnesses. These numbers will change, depends on where we are in the pandemic. And depends on where you live, these numbers will change. Fortunately, we have not lost any patients in the past 19 months due to COVID. So far, we admitted under 10 children out of 15,000 due to COVID illnesses in the past 19 months. So what's the treatment? Suppose the child has a COVID illness, what's the treatment? Rest and fluids. Children don't eat well when they have any kind of cold symptoms. They will eat eventually. Believe me, trust me, they will eat. But we would like to avoid the dehydration. Any fluid is fine. Water, milk, buttermilk, soup, rasam, porridge, smoothie, you name it. I recommend something with the calories in it. So plain water alone doesn't have calories. You want to add something to have calories. The child wants to eat, the child can eat. That is fine. You can treat the pain and the fever with acetaminophen or ibuprofen. Acetaminophen is known as paracetamol in other countries. Again, find the temperature first. 100.4 or 38 degrees Celsius is fever. I usually tell my parents to wait until 101 or 38.5 before you give the medicine. The reason is I really want to know, is there really a fever there or not? Now, how long the fever is going to last? I told you about the 3 days of fever. So treat only if there's a fever. If there's no fever, please do not give any medicine. The child is older than 1 year old, you can give honey for the cough. When you give the honey, it could be any honey, plain honey in a spoon. Do not dilute with the milk or water. The thick honey helps with the cough. Saline nose drops helps. FDA does not recommend any over-the-counter medicine for cough and cold under 2 years. Manufacturers do not recommend anything under 4 years. I believe in Europe, the number is up to 6 years they don't allow because nothing works. Occasionally they do cause side effects. That is the reason. Avoid the complication. Do not overdo with the steam. Do not, I have a lot of kids and I end up with I won't say a lot of kids. I have some kids came with a steam injury, scald and burns because they're trying to do a steam inhalation. Black fungus epidemic happened just only in India. We are not sure why. Almost all the patients had either diabetes or high blood sugar. They had taken a lot of antibiotics, steroid. Some of them used the steam. Some of them have taken zinc. Please avoid unnecessary use of antibiotics and steroids. Some of you take vitamin D. Vitamin D can cause toxicity, same as zinc can cause toxicity. American Academy of Pediatric states there is no effective medicine. These medicines are not effective against COVID. Azithromycin, ivermectin, hydroxychloroquine for treatment or prevention. There's a monoclonal antibody available for adults. It could help in certain children. These are the high-risk people in children and adults. Overweight, obesity, immunosuppression, lung, heart problem. When I say asthma, it is uncontrolled asthma with the high-dose steroid, not the regular asthma. A lot of children have mild asthma, that's fine. Diabetes, kidney trouble, or pregnancy. Immunity boosters, 5 servings of vegetables and fruits a day. Your first size is, a child's first size is 1 serving. Like this, 5 servings of vegetables and fruits together. 3 fruits, 2 vegetable, or 3 vegetable, 2 fruits. Good amount of sleep, exercise. These are the things help to increase your immunity. That's all the slides I have. Sorry, I went over by 2.5 minutes. Again, thank you for the opportunity.
Thank you for the insightful talk, Dr. Ram. That was really wonderful. And I'm sure this brought a lot of clarity in dealing with COVID in children. Thank you so much. So now it's my honor to introduce our second speaker, Dr. Partheeban. He is a practicing Siddha physician for the last 18 years. Correct me if I'm wrong. He's completed Bachelor of Siddha Medicine and Surgery and graduated from MGR Medical University, Chennai 2004. Apart from that, he has undergone multiple special trainings, including anthroposophic curative education and social therapy for 3 years from Switzerland. I have not seen a Siddha physician do such extensive training in this special field because it is a fascinating addition. As we know, curative education is an interdisciplinary approach to providing holistic support to children, adolescents, and young adults who have significant challenges on their individual path of development, including developmental disabilities. He serves as the director of Swabiman Holistic Solutions for Autism in Chennai. He's offering integrated treatment modality for autism spectrum population using Siddha, Ayurveda, and Yoga. For all his contribution in Siddha medicine, he was recognized as Best Doctor in 2012 by Dr. MGR Medical University. He is an activist and creates lots of awareness about autism and childhood developmental disabilities in many national and international forums. He is an invited speaker in many forums and popular television channels in India, who is renowned for his immense knowledge. For physicians who focus on children's health as far and wide in Siddha medicine, he is undoubtedly one of those. We are very eager to hear you, Dr. Partheeban, and over to you.
Thank you very much, Doctor. Thank you very much for your kind words. I sincerely thank GCSMR for this opportunity, and especially my special thanks to Dr. Suloshan Mohan sir. I'll just start with the slide sharing. It was fantastic to hear Dr. Ram, because I just recently read a book written by Dr. Paul Kalanidhi, and it's his autobiography, When the Breath Becomes Air. When I read that book, I was able to understand how difficult it is to become a doctor and how rigorous the training. As Dr. Uma said earlier, how gruesome it is to become a doctor. Such a rigorous training they all underwent, and I sincerely have great regards for all of you. Thanks for this opportunity. Yeah, regarding COVID in India, this is an India-specific study, the ICMR one. So what they say is like less than 11.5% of COVID patients so far in India is children. So in some countries, especially like in South Korea and then Vietnam, there are more than 20% of children are affected. But most of the countries, the statistic is less than 13.5%. So in India, it's less than 11.5%. As Dr. Ram detailed about everything about COVID-19 in children, I would like to focus more on the social part of it. Yeah, I mean, we all listened to him. MIS, he spoke in detail on all the symptoms, yes, the comorbidities, what to look for. So this one thing I would like to add, the multisystem inflammatory syndrome in children, also called the pediatric multisystem inflammatory syndrome, is a potentially a serious illness in children that happens very delayed, post-infectious complication. So we have to look for the children for a long period, you have to be very vigilant and observatory for a long time. Yeah. So in India, especially, I mean, not so economically active, economically well-developed country like India, we have other social complications here because of the COVID. So the measures adopted to curtail the spread of the new virus, like lockdown, physical distancing, closure of schools and businesses, they all have a massive adverse impacts on children and adolescents in the long run. I mean, I don't deny it's all necessary. It was all necessary then, but now, so sometimes people say the punishment, I mean, the treatment is worse than the disease itself, So I personally see now, after 19 months of school closure, most of the children are having mild depression or other issues actually. So UN report also says in August 2020 warned that prolonged school closure could result in a higher incidence of dropouts. That we could see even in cities like Chennai. Also, we could see a lot of school dropouts for the past 1 year. The incidence of dropouts has been found to be higher among girls, especially, and children with disabilities, any developmental disabilities, I would say. It's been 19 months and none of the special schools in Chennai are functioning, not just in Chennai and all over the India, because the last preference was given to the children with developmental disabilities. Just for an instance, I'm sharing this. And in a bigger and the richer state like Maharashtra, so they have a fantastic program called as Digital Infrastructure for Knowledge Sharing. This program was especially started to help to cater to the educative needs of the children who didn't have access towards a smartphone, a laptop or desktops in their home. So the education respective to their standards, they were all relayed in a television, but only 30% of the children were having access to it. So that is the condition of our country now. So many teachers also face challenges due to their lower level of difficulties in digital literacy. So there was something called a child care. We still have that in our country. They received 92,000 calls in this 1 year period. Out of that, when they immediately announced a lockdown, the 10 days they have, 11 days they had 1/3 of the calls. So there's so much of domestic violence happened to children in this particular period, and we all know this without saying, the cyber crimes, cyberbullying against the children, that is on alarming rise everywhere in the country. And current analysis attribute children's vulnerability to the heavy use of internet and social media. Since children have to spend more of their time in the digital world due to their education on online classes, so these are becoming very unavoidable these days. And cyberbullying, it has a profound impact in their self-esteem for both the offender and the victim. Another challenge among adolescents was heightened COVID by increase in domestic workload, especially the girl children were made to do a lot of domestic work at the home in states like Bihar, Rajasthan, and Uttar Pradesh, and the study says so. So this is a pattern more clear among the girls. Children and adolescents are more vulnerable to mental health issues because they are unable to comprehend the entirety of the situation. As Dr. Ram mentioned, all the children may not express the depression the same way. So we have to be very observant and we have to be really supportive to them on these stages actually. The vulnerability was heightened as the pandemic disrupted their normal lives, especially deprived them of their schooling, concomitantly opportunities for physical activities, social interaction. There were no group games happening, no cycling, no skating in the grounds, swimming pools were all closed, So this really had a huge impact in their mental health too. As the health crisis unfolded, high amounts of information, we all know this, floated in the social media, most of them were false, unverified informations. So this had a very profound impact about creating more fear, more scary thoughts in children, made them even more vulnerable, more than the real facts actually. In response to the heightened vulnerabilities of young people's mental health, our governments, not just the union government, but also the respective state governments, launched many programs. One is the Manodarpan. It is a very good program. Many children can call them and then get parents also approach them for the support. It was very successful. Kerala, they had something called as very interesting helpline, Kutti Desk, as part of larger program called Our Responsibility to Our Children. Over 200 children were selected and trained to run the program. It's a child-run program actually. Again, COVID gave room to a lot of opportunities too. COVID-19 is certain to impact the food, nutrition, and health security of our children, because most of the children in the rural side, in my state and other states of India, they all dependent on integrated child development scheme, ICDS, functioning with the help of UNICEF, and the midday meals. And most of the states in India, they have the midday meals, nutritional meals providing to the children. So all these services are affected for the past 19 months. It led to a lot of malnutrition in children, yes, and nutritional deficiency. The vulnerability would be higher in rural areas because most of them are dependent on these programs, the government-run programs especially. This year, the India-specific Global Nutrition Report 2021, they highlighted the stark inequalities in accessing food and healthcare in India. The report emphasizes the underlying importance of maintaining food supply. So after this report is published last year, like 6 months before, the Tamil Nadu government started providing them the dry ration, but they cannot give them the cooked food, cooked meals, nutritive meals due to the unavailability of the school functioning system. But they went every home by home and provided them dry ration. According to the survey, this is very important key point actually, the lack of physical activities in the Delhi and then the 4 cities, Delhi, Pune, Bangalore, and Hyderabad, they participate in the city. The Delhi study says a large 84% of parents were really worried about their child's increased screen time. There was no option, right? Because they have to do all their academics through the mobile or the computer. Another study conducted among 30 to 25-year-olds in both rural and urban areas found average screen time has increased to 5.12 hours from 3.5 hours, which was normal earlier. And reduced physical activity, of course, in parallel heightened sedentary behavior at encouraged. She's associated with loss of muscular and cardiorespiratory fitness, weight gain, psychosocial problems. So Dr. Ram mentioned in detail about the depression and poor academic achievement and ophthalmic issues. And I could see, and I know most of the eye hospitals in Chennai, or they have a huge waiting list for the children, myopic needs. Evidence suggests that the negative impacts may have ripple effects or long-lasting effects throughout the adulthood of the sedentary behavior. As for Siddha intervention is concerned, because I'm part of the committee constituted by Government of Tamil Nadu's Indian Medicine Department to devise of policies in case of the probable third wave, which may disproportionately affect the children. That was the talk for 3.5 months before. So for that, the committee was formed, and I'm a member of the committee. So we were supposed to work and give them a module, in case of what are the interventions through Ayush and Siddha especially. So these are the medicines which were suggested by a team, symptomatic and prophylaxis care. So for asymptomatic children, if they are exposed to some patients with the COVID-19 in their family or the neighborhood, they can be given Kabashura from 5 ml to 30 ml for 7 days, depending upon their age and their health status. And Murai Matre is working very good for the prophylaxis of many other viral infections. And in case of mild or moderate symptoms like fever, dry cough, sore throat, nasal erythema, nasal congestion, headache. So this Talisadi Churanam in a very low dose for the child is 250 milligram, thrice daily with honey for 3 or 5 days. because most of the symptoms or mild symptoms in the children are not long lasting. You can see improvement in 3 to 4 days itself. So you don't have to give medicines for 3 or 4 days more, not more than that. This will do for the, because 90% of the children are in this category, whoever is getting affected. It is a fantastic, simple herbal medicine. It is very soothing to the throat. It has to be given with the warm water, 2 to 5 ml for 15 days. And it helps immensely. And Nellikai Legium, the fantastic immunomodulator. And Shayachurnam is a very simple herbal combination, a formulation of 4 herbs. It is giving a instant relief for children who are having this throat infection and then the difficulty in swallowing sometimes, and this pharyngeal erythema. And these are the symptoms that can be easily tackled with the Shayachurnam. 3 days is enough, not more than that. And if anyone have more headache, especially the teenagers, the Neerkorve Patru is not the internal medicine, it's an external medicine, can be applied topically over the forehead and these nasal regions. And symptomatic approach. So this is for the full-blown COVID children, especially for children, many they have diarrhea, and then Chundevatral Churnam immensely helps. So this is a very key part of our guidance to the committee. And the abdominal pain, Omatinir helps. I have given a lot of medicines as an alternatives. It does not mean that we have to give children and bombard their health with so much of medicines. Certainly, that is not the message. It is just the alternatives, because in with respect to Siddha medicines, not all the medicines are not available in everywhere. So whatever is available in this group, that can be administered. So that is the goal of this presentation. And the spoon to thin for a throat infection, pharyngeal erythema, it can be some home remedies. It's very helpful. And Palagare Parpum for the alleviating the allergies, it helps immensely. And for fever, Bala Sanjeevi Matra is a trademark medicine, Siddha medicine. So that can be given for children for 3 days, 2 times a day. So these are the effective symptomatic management to Siddha systems of medicine. As for diet is concerned, this plays a huge role. I mean, we can talk about hydration 1,000 times for 1,000 days, and it's never enough, because parents needs to be really focusing on this particular part. The child is sick or unhealthy. And protein-rich diet, soups, watery scoops, again it adds for the hydration part. Sprouts, steamed sprouts especially. And for the protein supplements, some safe supplements like groundnut balls, sesame balls. And we just have to ensure the child is not allergic for peanuts. So that has to be kept in mind. And Panchabutti Kanji is a porridge in Siddha system. Panch means 5, so 5 proteins will be the part of this kanji. And it is very light. It is not heavy at all. It is very light, easily absorbable, give much nutrition strength for the children to endure the illness. Then the Ulundu kanji is full of lipoprotein. This lipoprotein gives them an amazing endurance, to endure the disease and illness. And warm milk with a dash of turmeric powder. It's an age-old remedy, and we recommend as part of the Siddha protocol. And Karisale malt is fantastic liver tonic. Karisalangani is a liver tonic medicine, liver tonic herb in Siddha system. It is very helpful. And go for a easily digestible food, not a very spicy, not very heavy food that way. Go for a easily like kanji, rice gruel, porridge, idli, steamed food, shiragatanni and things like that. And pudina tea in a diluted form, chukumali tea in a diluted form. They're very digestive and helps them, to eat their food more, and then so that they get the energy to stay healthy. Apart from the food, the other important aspect is to take care of their mental health through yoga. Because why I say yoga is most of the time children are not going outdoors. So indoor yoga and pranayama, the respiratory health, pranayama, and meditation. When I say meditation, it is not a very high-fi meditation which I meant here. Just sitting down quietly without gadgets, So that is a meditation. We call it as that is a new normal of meditation these days. Sitting quietly without any gadgets, be it television or mobile or laptops or palm tops, anything. Sitting quiet is the meditation these days, and children need to be trained for it. And outdoor activities to get the more sunlight. We all know about the vitamin D deficiency, which is on the alarming rise these days, especially for kids. and find out innovative ways of engaging them with the resources available at home, sorting activity, transfer activity, playing inside the home. These activities can be devised and supported by the parents and other elderly caregivers for the children. If possible, make provisions for indoor play, like board games, art, craft, listening to music, learning for a new musical player, stuffs like that. And children can be included in domestic chores, to just for as an hobby, like cooking, gardening, and stuff. So in my country, again, like this Psycho B vaccine has been approved last week for 12 to 18 age group of children, and there is one vaccine, Covaxin is waiting. It should be approved within a week for 2 to 18 years of children. So these are the real hopes which we are looking forward. Till then, we can live happily with Siddha medicines. That is what I want to tell you. Thank you very much. Thanks for the patient listening.
Thank you, Dr. Partheeban. That was an in-depth and detailed talk. You covered a lot of information. You gave a comprehensive approach in dealing COVID-19 in children. It was excellent listening to you. Thank you so much. So I'm going to open the forum for question and answers. So if audience, if any of you have any questions, feel free to unmute yourself and ask questions to our speakers. Or if you want to just put your questions in the chat box, I can forward the questions to the concerned speakers. Please go ahead.
Hi, this is Padmashri. I have a few questions with me. Can you hear me?
Yes, go ahead, Padmashri. We can hear you.
Yeah, thank you. My question is, like, when my child is exposed to COVID, within how many days I should go and take the test? For example, say my kid, she's 5 years old, she's going to school, and suddenly one day I'm getting a mail like one of her classmates is exposed to COVID and we should quarantine. So my question is, I mean, though the symptom is not visible on her, I just want to ensure, I mean, the number of days within which I have to go and take the test so that I can make sure like I am safe and I can keep my environment safe.
Absolutely. Dr. Ram, do you want to take this question?
Sure. Yes, Dr. Uma. American Academy of Pediatrics recommends 3 to 5 days from the last known exposure. So I usually ask my patients to wait up to 5 days if they don't have symptoms. If you have symptoms, start this immediately and get the test immediately. So 3 to 5 days is the answer.
Okay, thank you. Thank you so much, doctor.
You are.
Anyone else, any questions?
I have a follow-up question for Dr. Ram, but in those 5 days, they should isolate the children, correct?
Yes, they should isolate because we don't know whether they have a COVID or not. And what we found out is 2 days before they're being positive, that is when the most infectivity happens. The 48 hours before the test result, that's when the most they're most infective or contagious.
Thank you, Dr. Ram. So I have another question here. So they're asking, just a second. So Mr. Shiva is asking about how do you all deal with neonates born to COVID positive pregnant women? So I would like to take on this question from both the doctors. Maybe Dr. Ram can go first and then followed by Dr. Partheeban.
It's a very good question. The answer changes very frequently. Nowadays, there is not, we just ask the parents to take care of them as usual, but we do recommend the mom will be wearing the mask, and any caregiver, they should wear a mask because the other caregivers with mom, they're already been exposed. Either a dad or a grandma, grandfather, they're probably exposed. And if possible, keep the distance away from the mom, 6 feet away. It is not always possible because it's a hospital room may not be long enough to keep the 6 feet away, but when possible, do this. It is fine to do the breastfeeding. Either mom can pump the breast and give the pumped breast milk. If not, direct breastfeeding is fine. But always let the mom wash the hand and wear the mask and then do it. And fortunately, we haven't had that many neonatal problems with this. Most of the time, in our hospital and most hospitals, they check the moms who come for deliveries. They routinely check for COVID. And we very rarely have a problem with the neonates with the COVID. It doesn't mean zero. We usually don't have an issue with it.
And thank you, Dr. Ram. Dr. Partheeban, do you want to add anything to this?
I think I'm very comfortable with this, all the information which I wanted to share. Thank you.
Okay, so thank you. And, there is another question specifically for Siddha drinks that can be given to boost immunity for kids around 5 years of age. Please, Dr. Partheeban.
Usually, I don't recommend any health drinks for very smaller children. So it is very safe for them to have a very healthy food. Home cooked food, especially with a lot of vegetables, ghee, dal, and fruits. So that will give them enough immunity to deal with the healthy life. So only in case of any digestive disturbances or fever, then you can go for herbal decoctions. Otherwise, it's completely not needed. The healthy homemade food is enough. So that will do. That will take care of them actually. Yeah.
Perfect. Thank you, Dr. Partheeban. And there's another question for school reopening. Dr. Jaya Venkatesh is asking that what would be the mentality of children for initial few weeks, and how would the teachers handle children after an interval of 19 months? So, Dr. Partheeban, do you want to go for this?
Yeah, so we are working with few schools here in our neighborhood actually. So the teachers actually, they have lost in touch because they have got adopted to the new normal of taking an online class, and then so they are really looking forward to connect with children personally, because they didn't feel much free when their classes were watched by the parents of their children. So they all felt not very good about it actually. Now they wanted to go back to their own space where they can really connect with their own children and take them in their fold. So I personally feel it will be both the children and the teachers will be waiting to reunite, and that is a mood I could sense actually. So it should go very well.
That's so beautifully said, Dr. Partheeban. So there's another question. In southern US, in some schools, boards are actively preventing kids from wearing masks. And we know this mask issue is a huge issue throughout the country. So some of them are coming to school even with COVID. Is there any additional precautions that can be taken from our end other than masks and advising kids not to touch eyes, nose, and mouth? Dr. Ram, please.
It's a very difficult situation. Those two things what you mentioned, those are the only thing proven to help. And we can educate the children what situations to avoid. Believe it or not, children still, they swap their mask. Child goes there and like somebody else's mask, they do take the mask out and they put the other mask on. The younger ones, hopefully the older ones don't do that. Still, children do share their food, sharing the spoon. Those things they can avoid, and then get the vaccination when it's available for younger children under 12 years of age. And we'll hope for the best. Hopefully Dr. Partheeban can add more things.
The situation is good here. It's going to be not so different from, I think the children are children everywhere in any part of the world. So they would like to experiment with what they have, and they would like to show their mask design. Nowadays you get this fancy mask The children are very excited to share that with their friends, and of course the box meal after a very long time. So I think it's going to be a fun time for the teachers, especially like, to put them to control them. I think we'll just have to work, with them in a very friendly manner. I think they will also listen because they are so used to seeing their elders at home in a very different way these days. So I'm sure they will also follow the COVID appropriate behavior. They will listen more to their teachers than to their parents. I'm very sure about it. Yeah. Yes.
That's totally true. So, I just have a quick question myself on vaccination. Maybe I'm going to reflect audience's opinion on this as well. So for the vaccination, Dr. Ram, like there are so many, anti-vaccine people here, and they have a lot of concerns in terms of taking the vaccines for 12 to 18-year-olds. And now if the FDA is approving the younger ones as well. So what's your take on this, and how do you advise parents when they come up with concerns of myocarditis, pericarditis, those kind of questions?
So probably first we'll talk about the myocarditis. And morbidity, mortality document is released by CDC every 1 to 2 weeks. And the reason what they mentioned is the baseline myocarditis. For the audience, myocarditis means the inflammation of heart, which does happen sometimes after the vaccine. That is a recent concern came to light. This is not shown in the initial studies. It was only shown later study when the post-marketing follow-up. But any vaccine is released or any medicine is released, FDA and other international agencies, they will be looking for side effects. That's how they found this out. If you don't have a vaccine, the baseline rate is 10 per million. So children who are 12 to 16 years of age, out of 1 million children, 10 will get a myocarditis due to various reasons. Either they had a viral infection or autoimmune condition, some other reason. When they receive the vaccine, the risk goes up to 50. So you can look at this data in 2 different ways. You can say the 5-fold increase, 50 out of 1 million. 50 out of 1 million, in my opinion, is a very low number. And all these children, they all recovered themselves with some supportive measures. Some of them were admitted in the hospital mainly because of abundance of caution. They all did fine. But if you look at the risk of getting the COVID, even in children, very low risk of severe COVID, still the risk is higher compared to the 50 per million. So these kind of numbers, these kind of very rare side effects would appear. They'll only be found out if you immunize 10 million children or 15 million children. That's the only time you will find this out. You will never be able to find out the studies you have done by few thousand kids. On the whole, this vaccine seems to be very safe and effective. Almost everybody will have the reaction like a fever, redness, swelling, those kind of things will happen with any other vaccine. This is a very concerning question, Dr. Umas, you mentioned it's many parents are concerned. They think the vaccine is fast track. So think of this way. Usually any disease we are developing a vaccine, for example, we are developing a vaccine for a meningitis. The recent vaccine came out for meningitis B. That thing took a long time to develop, mainly because they didn't have funding. These companies had a lot of funding from the governments, and there's an emergency need, dire need needed, and then the volunteers are easily available. These are the reason the vaccine was expedited. But if you look at the same observation period, the number of participants that try on the vaccines, very similar. So this is not really fast track. Yeah, everything happened within a few months, but it doesn't mean they did a shortcut. The usual procedures, what they had to follow, they did follow. So it is safe to get the vaccines. I understand that some parents are worried. Some parents want more numbers. Some parents want the vaccine need to be given 10 million children before they get the vaccine. It's more like a parental perception. But it's a very good question. It's a very common question I've been asked.
Thank you, Dr. Ram. That really helps. Follow up on the question Mr. Vishwanath is asking, are all the vaccines are allopathic? Any research happening in other practices like Siddha or Ayurveda to get equivalent immunity boosters? Maybe Dr. Partheeban can take this.
I'm so unfamiliar to this question actually. So, okay. I mean, vaccine is a very new concept. We are only 7 or 8 decades of this practice. So Siddha is much ancient medical system, like, they say at least 2000-year-old medical system. So we don't have anything similar to vaccines and Siddha system of medicine. If you ask me as a person, like, I work with mostly children with autism. So many parents ask me, they all think that vaccines cause autism, most of them at least. But I always say this theory has been disproved, it's dismantled, don't believe in such theories. Vaccine is a savior for children, especially humankind. This past 7 or 8 decades, we have survived so many outbreaks of, like from polio and chickenpox. We have survived many break only through vaccines. So there might be some shortcomings, 1 or 2, but it will evolve to get better years wise, as years advances. So don't be very skeptical about vaccines, because all these vaccines are not only given for children in our house, children all over the world. So everyone will be having their families, so it will be completely tested. So for me, like, whether it's Siddha or allopathic, does not matter, but go and get vaccinated if it's available for the children. So that is what the need of the hour. That is what I wanted to tell you.
Thank you, Dr. Partheeban. Any other questions from the forum?
Dr. Partheeban, this is Sivasalam. You touched on it. That was one of the questions I was going to ask. In the US, for the last 10, 12 years, a lot of people believe vaccines caused autism. And it's, I think those, even though there are a number of studies that have disproved that, like you mentioned, it's still out there. Is that kind of a feeling in India too with autism, or is it only it's a Western phenomenon?
Well, it's so that type of feeling, not just in India, certainly everywhere, because there are so many Facebook groups, parent forums where they share information about Dr. Andrew Wakefield study, and that has a profound impact. Even now, there are many 20-year studies and 3-decade studies by universities which has disproved the vaccine toxicity as a theory. But even last week, I was talking to a friend in Bangalore. He was talking to me about vaccine detox by homeopathy. So these are the new businesses you could see in places. So there are vaccine people who don't believe in vaccine are on the rise, like how autism is. So we have to fight both together. Yes.
Anyone else?
Yeah, I see from the audience, Dr. Sivasubramaniam. He's a professor in Georgetown. He's a pediatrician and a neonatologist. So I don't know if he wants to add anything on vaccination.
No, I think, the presenters have done a fantastic job. Dr. Ram has, touched base with all the current information, and as well as Dr. Partheeban added what he is doing, particularly, the last question about the autism and the spectrum being associated with the vaccine has been prevalent, both not alone in the United States, but also everywhere. And so that both of them have addressed it, that it is something disproven clearly. And so you can be very confident and comfortable. And as far as the aspects of in terms of neonates and newborns, what Dr. Ram said is absolutely correct. There are very luckily, very few babies have been affected. And it is just insisting and making sure that they will continue the breastfeeding is the right advice. So, thank you. Great presentation.
Thank you, doctor. So there's one more question from the audience. What about the children, those taking vaccination till age 7? Any complications or adverse effects for COVID vaccination? Is there any study for that age group? Dr. Ram, do you want to take this?
Sure. I don't have the actual number, how many children have been. The Pfizer submitted the study about the vaccine. They submitted the study 5 to 12. I believe it is a couple of thousand, but I don't know the exact number. Those were the children received the vaccine. They looked at the side effects and the effectiveness. They did not find any significant side effect, I believe. At least it's not released to the public yet. And they did mention it's effective. So I don't know what the actual side effects are. I presume it is minor, because the expectation is FDA is supposed to do the approval soon. If there's an issue, they would be talking about this. So I don't have the answer to that yet. That will be released to everybody soon.
Great, thank you. Another question, Ms. Ratna is asking, I have a friend who had taken vaccination but ended up having COVID, and his entire family, wife and small child got COVID. They got all right after a few days. My question is, if you do end up with COVID and do get all right, are there any complications or things you need to be aware of in future with regards to kids? Dr. Partheeban, do you want to take this?
Only one point I would like to add. So even then, like once they are all right, you have to watch the children for at least 3 to 6 months. For some children, I have seen there are in one family I've seen a tuberculosis case within 2.5 months of infecting with the COVID. So these things, because of the immunocompromising conditions, we have to keep watch at least for 3 to 6 months times. So that is what I would like to add.
Do you want to add anything, Dr. Ram?
Sure. So this is a topic is constantly evolving. So American Academy of Pediatrics came up with a guideline to participate in sports. The reason they focused on the sports is doing the sports, heart will be working harder. So that if there is a myocarditis happen to the heart because of the COVID, that could cause a problem. So they came up with the numbers, how many days of illness the child had. They're mainly numbers looking for either a prolonged fever, more than 3 days, or a myalgia, without a fever, just a body pain more than 5 days. These are the numbers they looked at. Or has a child been hospitalized after a severe COVID? Based on that, they suggest either getting EKG and a physician visit. Otherwise, if the child had a common cold illness, the fever was under 3 days, and is not a prolonged body pain, then they do not recommend any special precaution. Watch out for the same symptoms, either a chest pain, either a difficulty breathing. Those are the symptoms you should be watching for. I rarely had a child who had a prolonged fever. I say prolonged fever, I'm talking about 5 weeks of fever, 35 days of every single day fever. The child underwent cardiac workup, but child was completely doing fine. So those, and then some kids had a lost smell for a few months, and some of them are very fatigued and for several weeks. Those things are unusual complications. They call a long haul COVID. They do happen. And still the studies are being done why some children are prone to this kind of prolonged illnesses, not others. So back to the question, from the important answer for your question is, how many days of fever, how many days of body pain, how long the illness was. Based on that, the decision will be made.
Thank you, that makes sense. Okay, any other questions? If not, we can wrap up the session. Okay, so I'm going to hand this over to Dr. Rama. Rama, please go ahead.
Thank you, Dr. Uma. Vanakkam and greetings to everyone. First, I would like to bring to your kind attention the aim or the motto of GCSMR, Global Center for Siddha Medicine and Research. It is bringing Siddha medical knowledge to the fore through advanced research. தமிழ்ல சொல்ல போனோம்னா சித்த மருத்துவரோட பெருமைகளை நம்ம வந்து உலக அரங்குக்கு கொண்டு வர்றதுதான் GCSMR-ஓட முதன்மை கடமைன்னு நாங்க நினைக்கிறோம். ஸோ அதை இங்க நான் சொல்லிக்க விரும்புறேன். I would like to thank GCSMR for hosting great webinars, especially during the pandemic time. We have been continuously doing a lot of webinars regarding pandemic with children, mental health for women, and we covered almost everything. And please stay tuned for many more to come. And also we welcome any topics you guys are interested. Please email us to gcsmr20@gmail.com. Now I would like to thank Dr. Ram for his insights on COVID-19 in children and back to school concerns. He gave a clear difference between the common cold, fever, and COVID-19. So as parents, what we all do is we go into a panic mode, which is normal and understandable. But right now, all we have to do is understand the differences and act accordingly. So we can, there are symptoms that we need to consider, and there are symptoms that's going to be normal during the course. And thank you, Dr. Ram, again for sharing wealth of information. Next, I would like to thank Dr. Partheeban for sharing Siddha ways to cope with pandemic stress in children. He explained about several problems that the children went through or still going through the pandemic crisis. It's an ongoing thing, like Dr. Ram and Dr. Partheeban said. We have to continuously watch our children, and we have to give all the help they need. I would like to thank Dr. Partheeban again for the valuable information. And Dr. Uma, she did a wonderful job introducing and moderating the webinar, especially, she kept on with the time, and that is a very great thing to keep. We were able to cover all the questions, and we kept every information within the given time. Thank you, Dr. Uma, for doing this for us. Next, I would like to say that, donors are the sole source of success for any nonprofit organization. Without donors, we cannot go anywhere. So we appreciate any donations for this. We are a nonprofit organization, and we are tax exempt here in the United States. So hopefully all the listeners, and yeah, you can share it with your friends, and we appreciate any donations, even of any amount, because as you say, as we all say, Sirithuli Peruvellam. Every single penny counts. ஒவ்வொரு சிறு துளியும் சேர்ந்தாதான் பெருவெள்ளமா மாறும். அதையும் நான் வந்து இங்க சொல்லிக்க விரும்புறேன். Next வந்து நம்ம website. Please visit our website www.globalcenterforsiddha.org. I also posted the same in the chat box. So there's a lot of information in the website regarding Siddha. There are a lot of videos that Dr. Selva, Dr. Arul gave us, and all the webinars information, all the links are there. You can go and hear our webinars that we had done previously. There's a lot of information for you guys. And there's also a lot of Siddha recipes, like, Chukumali Kapi, Ulandankali, whatever you name it, it's there. So it's a lot of information in our website. Please visit our website. And also, I would like to bring to your kind attention that we are working with American Tamil Radio. It's an online radio here in America. We are going to broadcast several Siddha tips continuously during several sessions. So please stay tuned. And if you're interested, share your email ID either in the chat box or email us at gcsmr20@gmail.com. Thank you very much. Thank you, Dr. Ram and Partheeban and Uma, and all the organizers in GCSMR, especially Dr. Selva, Dr. Arul, and Sivasayalamana. Thank you, everyone.
Thank you.
Thank you.